Hello there! Welcome to the Society of Gynecologic Oncology of Canada's HPV Awareness Platform. This video will provide you with the most up-to-date and evidence-based information about HPV, its consequences, and what you can do to protect yourself, including information about the new HPV vaccines. This video will allow you to make informed decisions concerning your own health and well-being, and for those you care for. This animation is available in English and French, along with subtitles in multiple languages, which you can easily access from the drop-down menu available on the bottom right. So what is HPV? HPV stands for human papillomavirus and is a common virus that may cause cancers in both women and men. Currently, it affects 80 to 90% of sexually active women and men worldwide. It is spread by sexual contact and enters cells via breaks in the skin. Thankfully, 90% of infections are cleared by the immune system, but if the virus stays within the cells, it makes the cells divide uncontrollably and can eventually lead to the development of cancer. There are over 100 different types of HPV virus, but two of the types, called HPV 16 and 18, are the ones most commonly responsible for causing cervical cancer as well as cancer in other parts of the body. Cervical cancer is the second most common cancer in women worldwide, and the number of new cases is expected to rise due to increased spread of HPV infection. It develops as a spectrum of disease. This means that a small precancerous lesion may progress over time to a more advanced lesion and ultimately cancer if there's persistent HPV lesion, in cases that the body is not able to clear the virus, or if the lesions are not detected and treated early enough. HPV is also associated with other types of cancers, including vulvar, vaginal, head and neck, penile, and anal cancers. It can also lead to precancers and genital warts. Vulvar cancers and precancers are rare and usually associated with symptoms of itch, pain, or a mass in the genital area that does not go away. Because of a rise in HPV infections in the last 20 years, there has been an increase in vulvar cancer in women aged 20 to 45, while non-HPV associated vulvar cancer is more common in older women. HPV is also associated with cancers in the head and neck. While in the past smoking and alcohol were the major culprits for causing head and neck cancers, HPV 16 associated cancers are on the rise, especially in Western countries. These cancers are specifically found in the oropharyngeal area, which most commonly include the tongue or the tonsils. They commonly present as slow-growing bumps or masses in the mouth or on the neck. Anal and perianal cancers are also on the rise due to HPV infections. Anal cancer is more common in women and in men who have sex with men. In males, 33% of penile cancers and almost all of anal cancers are caused by HPV, primarily with HPV type 16. Penile cancer is a rare and devastating disease that requires extensive treatment and may affect sexual and urinary functions. HPV is also known to cause genital warts, which are most often related to HPV 6 and 11. They are benign conditions but cause skin lesions that may be irritating and disfiguring. They only lead to cancer if associated with a different higher risk strain of HPV. Risk factors. Everyone is at risk of developing HPV infection through sexual contact. This can include vaginal, anal, or oral sex. The following are things that could increase your risk of contracting HPV. 1. The number of sexual partners. Having multiple sexual partners, more than 3 in a lifetime, can increase your risk by threefold. 2. Smoking. Smokers have a 60% increased risk of HPV-related cancer. Chemicals and nicotine found in tobacco have been proven to help the virus stay in the cell and divide more quickly to cause cancer. 3. Oral contraception. Oral contraception pills may increase the risk of cancer in women with HPV because the hormones may promote production of HPV within the cells. However, the risk is no longer increased after 10 years of stopping the pill. 4. HIV or HSV. HIV-positive individuals have a 2.6 times higher chance of getting HPV and having a persistent infection. Those with herpes have a higher chance of progression to cervical cancer because of a higher inflammatory response. HPV vaccination. One way to prevent the HPV virus from entering cells in the body is by vaccination. There are currently 3 different types of vaccines available to help protect your body against the virus. 1. Cervarix, which protects against HPV 16 and 18, the 2 types that cause 70% of cancers. 2. Gardasil 4, which protects against HPV 16 and 18, the cancerous types, plus 6 and 11 associated with warts. And 3. Gardasil 9, which protects against HPV 6 and 11 and against 7 types of HPV that are associated with the progression to cancer: 16, 18, 31, 33, 45, 52, and 58. This vaccine could prevent around 90% of cervical, vulvar, vaginal, and anal cancers. All 3 vaccines work by injecting a virus-like particle, causing the body to create protective antibodies, which will stick to these particles and create memory antibodies. These memory antibodies persist for years to decades in order to fight against the real virus during a future HPV infection. The vaccine has no live virus and cannot cause disease. The vaccination is more efficient in making these antibodies than a real HPV infection. It is important to note that if the entire population received the HPV vaccination, 3/4 of cervical cancers would be cured or eradicated. Who may benefit from vaccination? Children 9 to 15 years make the highest amount of antibodies and protection against HPV, and therefore the best time to be vaccinated is at this age. Women aged 15 to 26 are at high risk of persistent HPV infection due to sexual practices, lack of access to a physician, and peak age for pre-invasive lesions. The vaccine is newly available to women of all ages with no maximum age. This may benefit women treated for cervical precancerous lesions in order to prevent recurrence. In men, the vaccine has also been shown to lower HPV infection and rates of associated cancers. The advantages of vaccination include higher antibody production after vaccination compared to natural infection, eventually eliminating HPV and related cancers forever, like polio and smallpox, lower reinfection and recurrence rates after treatment, lower incidence of precancerous and cancerous lesions of the cervix, vulva, vagina, penis, and anus and genital lesions, reduction of preterm birth in those patients that eventually get pregnant, and in the future, with hopes that the vaccine will reduce and possibly eliminate precancerous lesions, there may be less need for Pap screening and HPV testing every 5 years. There are a few challenging features of vaccination, which include a high personal cost if not covered by a publicly funded system. However, portions can be reimbursed by insurance. Currently, 3 doses are required in the over 14 age group. Accessibility, as only 6% of girls worldwide have been vaccinated since 2006. And misconceptions about the vaccine, including risks of infertility and increased promiscuity in young teenagers. Side effect profile. The most commonly reported side effects are pain, redness or swelling in the arm where the shot was given, fever, headache or feeling tired, nausea, and muscle or joint pain. Although most side effects resolve on their own, Gardasil 9 has been shown to have more side effects than Gardasil 4. Non-vaccination. Choosing not to be vaccinated means accepting a higher risk of persistent HPV infection and thus the risk of developing cancer and requiring treatment. Surgical treatment with radical hysterectomy, meaning removal of the uterus and its surrounding structures, would prevent women from future childbearing, while chemotherapy may affect ovarian reserve, meaning the eggs that are left in the ovaries, and thus decreasing fertility rates. On the other hand, advantages to not being vaccinated may be avoiding costs associated with the vaccine if not covered by a public vaccination program, avoiding the potential risks of side effects and pain from injection site, and possible distress related to vaccination. In addition, if most of the population is vaccinated, those who are unvaccinated still have a level of protection against the high-risk types of HPV. This is a phenomenon called herd immunity. Pap test. HPV vaccination doesn't replace cervical screening. Pap testing should continue as part of prevention for cervical cancer. The Pap test consists of a gynecologic exam where a doctor uses a speculum to examine the cervix and a special brush to sample cells and send them for analysis. If the Pap test is abnormal, examination and colposcopy is required, where a microscope is used to look at the cervix closely. Biopsies may be taken if there's anything that looks abnormal. If the biopsy reveals precancer, a more specific biopsy called a LEAP or cone biopsy is done to remove part of the affected cervix. If an early cancer is found, a surgical procedure to remove the cervix and possibly the uterus will need to be performed. More advanced stages of cancer may be treated with chemoradiation therapy. There is no routine screening for genital warts or vulvar or vaginal cancers and precancers. Suspicious lesions are usually detected, biopsied, and followed in colposcopy. Genital warts not worrisome for cancer may be treated with different methods, including freezing, chemical solutions, lasers, or surgery. In conclusion, overall, the decision for HPV vaccination will depend on your education and knowledge of the facts, values related to cancer prevention, self-perceived risk, cost, reducing possible psychosocial distress in a cancer diagnosis, and the importance of long-term outcomes of avoiding major surgeries, chemotherapy, and possibly death. Please proceed to the decision board to further determine if HPV vaccination is suitable for you or your child or family.